In this video, we're going to talk about emergency interventions and prohibited practices. In this video, we'll define what qualifies an emergency intervention, so understand the legal definition and the criteria for when it is an emergency intervention, and then we're going to identify the legal guidelines for restraint and exclusion. So what is permitted and what is prohibited when we're talking about physical intervention and seclusion. And then we're going to recognize prohibited practices and reporting requirements. So learn what is unethical and illegal, and then what kind of documentation you might need after an emergency intervention. So what is an emergency intervention? When can you use it? There's sort of three things I put here, and one is put as one, but serious injury prevention. So that's injury to themselves and others. A lot of kids with disabilities might harm, and so that would be included, but also injury to someone else. Really severe, unpredictable behavior that poses an immediate threat or danger. These would not be part of a behavior plan. They're not regular or routine. Typically, if we're seeing behaviors so severe, then that the behavior plan can't address them because they're always emergency intervention, we have to talk about placement. Is this the right place for the student? There should be a lot of meetings, changes to the behavior plan, the IEP, to address those behaviors. So what can you do? In an emergency, if someone's going to harm themselves, you can engage in short-term trained physical restraint. There's training for this, and you should request this training if you have not received it or it's not on the schedule for you to receive. There's lots of programs out there. CPI, PROACT, behaviors, I forget the full term, but there's a one with the behavior in the title. They're all really good. I've taken most of them. They're all similar. A lot of times, like NPSs or NPAs have a staff member who's able to provide the training and just will yearly provide this training for everybody. But it will teach you how to safely restrain somebody, typically with more than one person, in a way where you're not going to hurt them. And so you need that training before engaging in physical restraints. And you use your body to restrain them. You don't use anything else. We'll talk about blocking or movement redirection. So we can block like someone hitting. We can try to turn them a little bit. All those are allowed as an emergency intervention. They should not be part of a regular behavior plan. So a temporary physical separation in a supervised setting. So if two kids are getting angry at each other and one's escalating, you can remove that child from the peer and put them in a separate room. You cannot leave them alone. But you can sit there with them or another staff they trust. Whoever will be the most calming for them should be in the room with them. And this is to de-escalate them. And it should never be part of their behavior plan. We're not doing a timeout procedure as part of the behavior plan. The door should be able to open, but we can stay there to de-escalate them. And then we can also call emergency personnel. When things get so bad that you and the staff cannot control the situation, we do need to contact police or medical professionals to help us. I worked in an emotionally disturbed program, and a lot of them would either threaten or almost attempt suicide on campus. In all those situations, we would call police. Sometimes it just gets so bad that you need that extra help. It should never be part of the behavior plan or something we do on a regular basis. We have to go back to the drawing board of why is this program, this placement not working for this person? Because they're engaging in these really severe behaviors frequently right now. But these are all things you can do in an emergency to ensure your safety, the students' safety, other people's safety. What emergency interventions can you not do under any condition? This is the most important thing, I feel like, not of the whole training, but just understanding this legal piece of it and to keep yourself safe as well as the client and the student safe. Pain compliance techniques. We cannot inflict pain to gain compliance. That would be prohibited. So, in this state, there's no corporal punishment, but there are states where you are still allowed to do corporal punishment to students. And so not in our state. That would not be allowed. No pain techniques. I've seen people snap rubber bands for usually silly behaviors that we don't really need to be addressing so hard. You should never do that. I've seen students choose to do that as their own behavior management, which if they're choosing to do it to themselves, like something so small as snapping a rubber band on their wrist, that's probably like you can just let them do that. But anything more, if they're harming themselves, we'd have to address it, and you can never harm a student. Mechanical restraints. This is how that child lost their life, through mechanical restraints. All it means is like belt straps, chairs that can restrict movement. So tying someone to a chair using belt straps. I think they used a carpet to restrain. You cannot use anything else to restrain. Using PROAC or CPI for restraints, you would restrain the person with another person using your body. So that's really important that we never, ever do that. We never, utilize those types of techniques. And then we can never do locked room or unsupervised seclusion. So you cannot isolate a child in a locked room, and they cannot be in a room by themselves in a behavioral emergency. There must be somebody with them, a staff member. And it really needs to be the staff that's the most calming to them, like whoever they trust the most or whoever seems to connect with that student the best. That's who should be in the room. Chemical restraints. We cannot give medication that is not prescribed to calm someone down. I get really hesitant. I have had students who have a prescription for use in behavioral emergencies. I even find that a little iffy. I'd always allowed parents to do that, because a parent can do, if a doctor prescribed it, a parent could give it. I would never give medication. The only time I've ever allowed a child to take medication is through the nurse. The nurse sees the prescription. There's kids who get their stimulants on campus, and they go to the nurse's office, they take it, she makes sure they're taking the right dosage. That's the only time I have seen medications happen for a child. I'd be really hesitant with anything else. You really shouldn't engage in it. And we cannot withhold food or toileting. All those bodily necessary things like eating, toileting, even sleep. Sometimes kids come to their school so sleepy. I would never withhold that from them. So all these things you don't want to withhold from them as part of their behavioral treatment. That's a form of punishment, and it's considered cruel. So when to use an emergency intervention? Only when all least restrictive strategies have failed. This behavioral emergency intervention occurs. You restrain, you and somebody else restrain. You fill out all the paperwork, like everything's done above board and correctly, no one's hurt. What should you do next? What needs to happen next is we gotta start having meetings about how to prevent this. Like, what changes do we have to make so this doesn't occur again? I walk into these situations where they're asking me for help because I have my BCBA, and they're having behavioral emergency after behavioral emergency and never going back to the first behavior plan to look at those preventative strategies. What else can we do here? What ways can we prevent it? We want to prevent these at all cost. Once all least restrictive strategies have failed, then you can engage. If you can figure out this is escalating, try those less restrictive strategies. For example, the child's getting more and more mad and you're afraid it's going to result in some sort of harm to themselves or others. If you say, hey, let's go swing on the swings, and you just sit with them on the swing and talk to them, they're going to calm down. Do that immediately. And then the other thing is, like, when you do that, so what people complain about is, like, now all day I'm just taking this child out to the swinging, which is not learning. We need to go back to the original plan and look at it. And what other strategies can we put in within the learning environment to avoid the behavior emergency or stop the behavioral emergency? So it's all about planning and thinking about when something happens, what we need to change, responding to those behaviors for the next day. You only want it to be trained staff, so emergency interventions must be carried out by staff members who have received proper training and approved restraint and de-escalation techniques. So you should receive that training. It's CPI, PROAC. There's a couple of them out there. They're all fine. I've had questions like, is this one okay? I've never seen one that wasn't the same content. If your agency or school chose it, then the public school has said yes to it through the NPS, NPA process, and it's good. It will work. Must stop immediately once the danger has passed. Emergency interventions must be discontinued as soon as the immediate threat to harm has been resolved. These are not punishments. Once they've de-escalated, you go back to either the original day, like whatever they would typically be doing, or a day of less demands if you want to make sure it doesn't happen again before you can go back to the drawing board with the team and look at their program as a whole. You do not want to continue those things. This is not for property damage, noncompliance, or disruption. All those things are considered lighter problem behaviors as opposed to harming themselves or others. Property damage can be iffy if it's getting to the point where they're really damaging things, possibly getting to the point where they'll hurt someone. You might then go to those procedures. But for most of the time, the small property damage, you wouldn't use those emergency procedures. Okay, so there's some rules as far as the behavior emergency reports. You must complete a behavior emergency report. This must be given to the students' parents and guardians in the contracting school district within 1 business day. The report needs to say what happened and what was used. Attach supporting documentation if there is any, and make sure that you're very clear on what emergency interventions were used. Staff responsibility. You are responsible for knowing which interventions are permitted. You're also responsible for using trauma-informed de-escalation first. The whole swing example was an example of that. There's a way to de-escalate in a least restrictive way, an easy way. It might not be easy for you, but much easier for the student. You do that, whether that might be handing them an iPad when you were restricting iPad time. That might be letting them go in the sensory room where they just swing and play on the toys for the rest of the day. If you're able to do that, you do that. We're not going to make the rest of their life that. We're going to go back to the drawing board and look at the plan as a whole. Document clearly and immediately. So complete the behavior, the BER within 1 business day. You want to be truthful and not have delay. It should be accurate to what you saw and heard. Never put in like, oh, I think they were feeling this or that. Just say what you saw and heard and what you did. That's all you need to put in. And then you want to make sure that all your skills are up to date for skills on effectively managing behavioral emergencies. So that's that CPI ProAct class. And then this course should be up to date for you as well. Okay, thank you.